Good day, and welcome to our last chapter for our Unit 1 on demographic description and psychological characteristic of the consumer available in the market. I am Dr. Erwin Martinez Falier, your professor from Pharmacy Department, San Pedro College, and also the visiting professor of Bournemouth University, United Kingdom. So this will be our learning objective for today. At the end of this topic, the students will be able to, number one, discuss the demographic and social psychological characteristics of consumers that affect the business. Number two, to identify factors influencing customer decision. Number three, to determine current trends on pay for performance strategies for customer loyalty. So remember that as what we have mentioned last time, that it depends upon customer experience. Of course, it matters on what they have heard and what they have seen. And of course, display in the television, they have heard in the radio broadcasts, and of course, the marketing of every staff to deliver the best of their product. Now, with this, of course, the customer actually try to ask to the salesperson or maybe through the web or maybe looking at their catalog, of course, to their events or to sometimes to their packaging, to the store or office that matters on the decision of a certain customer's experience. Now, after they bought a certain product, medications, or anything that it matters on the product or services, then they're gonna be continued with regards to the surveys, newsletters, social media, forums, customer service, and of course, some loyalty programs. So there is really a connection of the salesperson towards the particular, shall we say, person or the one that buys the particular product, the customers, okay, or the client or our patient. So there is actually from the pre-purchase going into the purchase of the product, and then there is a continuous of what we call as post-purchase. Now, moving on with this, as we all know that it has really depending upon the customer service. Okay, so if your customer, your salesperson or your customer service specialist actually is not good in communication, there may be a problem in terms of buying the product, acquisition of the product, no? And of course, there will be no post-purchase. Okay, so it depends upon the customer experience. Now, moving on with the factors influencing consumer decision, there are different factors affecting on it, and one of it is actually on situational factors. And what is all about situational factors? So it entails there on the buying task and what will be the offer of the market. So it depends on the situation. If there will be discounts, if there will be a sale, no, it depends. And of course, if that would be the time we're in, your client has a lot of money, no, it is a payday, no, and some of the factors that affect would be on the personal factors. So what is all about the personal factor? So the personal factor would be in terms of demographics, life stage, lifestyle, and of course the personality. So like example, if your patient is shopaholic, of course they will always go to the mall, to the supermarket, not to buy certain products. So it depends upon certain personality. Maybe certain personality would be entail about cost saving person. Okay, a very thrifty person. So it depends upon the factors. So if that would be a patient or a client that is very meticulous, then so it depends upon how they actually scrutinize in terms of there's a discount, if there is really an effectivity of the product, is the product safe to be used, no? So there's really a massive demonstration to the certain client. Now, moving on with this would be psychological factors, like, for example, the motivation, learning, attitude, and belief of a certain. So it really of convincing factors to your client. Psychologically, you need to motivate them. You need to demonstrate to them with regards to the product, etc. And of course, lastly would be in terms of social factors. So what is all about in social factors? That to be in terms of the culture, the subculture, the culture of an individual, the social class, if that to be rich or poor, depending upon also with the family, how broad their family is. So of course, if you have a family of, shall we say, a member of family of two, so of course they will have a grocery or in the supermarket with a very less compared to a family who is very extended, okay, maybe composed of 5 to maybe a dozen in a family, no, it depends. And of course a reference group, no? So sometimes there will be references group to other family or other groups or individuals, no? So that is they would say that this product would be very good. So they really endorse the product to other individuals. Now, looking at also at the very bottom of it in terms of the consumer decision process, as what we have mentioned that it is a factor influencing consumer decision a while ago. But what are the customer decision making process? And the process entails steps. And one would be in terms of the recognition. Okay, they recognize that there is really a need of a certain product. And number two would be in terms of information searching and processing. So it may be in terms of internet. So like example, they go to um, Lazada or Salora or anything. So they need to search on it. Okay, if that would be in terms of a face-to-face encounter, that they need to go to the mall, to the store, no, and look at the product if it is viable in terms of quality, safety, effectivity, and others. So there will be a lot of factors with it, no. And once they already identify and they recognize and they already search and process that they really need this particular product, will be to identify and evaluate of certain alternatives. And what are those alternatives that they can have? Okay, so maybe this particular product would be very expensive, so they rather go to other supermarket or maybe go to other stores or shops wherein this product would be more lesser expensive, or shall we say more cheaper in terms of this. So maybe there will be some malls or supermarket that they have what they call discount or sale. So depends upon if they identify and evaluate the prices or any alternative with a certain product. Now, number four would be if they already identify if this is already a need, if this is already safe, effective, or viable for use, then of course that to be in the purchase decision. So this purchase decision matters on the influence of customer or consumer decision, whether it is situational, personal, psychological, social factors. Now, you really need the product, but then of course the salesperson does not actually entertain you well. So that's the major problem. So it's a turn off for a certain consumer or a patient, no? When sometimes the healthcare provider or the pharmacist is not actually entertaining the consumer well, no? And they will not really retain of the customer service because of the customer satisfaction, then lower customer satisfaction, then so your patient will not be retained. Now that depends upon purchase decision. Now, moving on to the last would be in terms of the post-purchase behavior. And what is all about post-purchase behavior? Now, in the post-purchase behavior, it's all about, as what we have already identified a while ago, that there is an assessment if they really satisfy with the product or the services that you have. Like, for example, a certain pharmacist uh, already gave the counseling, the product with a smile and all. So the pharmacist can actually tell to evaluate you with regards to the customer satisfaction then of the services they provided to the patient. Okay, that's what we call as post purchase behavior. So what is a feeling then of a certain consumer, no, or a client then, or a patient then, after they receive the feedback? If they already satisfied, of course, that will be a retention, okay? The loyalty of your certain customer or client or patient. Okay, so this is actually the 12 dimensions of business innovation, wherein when we innovate certain products, then there are a lot of things to ponder. Okay, there are a lot of things that we need to consider. Like, for example, your offering, what you can offer to the public. Okay, the platform in terms of the common components or the building blocks to create certain innovations or offerings then. Okay, so like, for example, discount, sales, no, and other platforms, and solution to the certain problem. If this product can solve certain solutions or certain problems or certain inquiries, no, and of course the customers. Okay, the customer, have they discussed to you unmet customer needs or identify unreserved customer segments? If there is really a product that is viable for a certain patient, are you satisfied then? So there is what they call communication with the customer. Okay, they discover unmet customer needs. Okay, and like, for example, a certain pharmacy who doesn't deliver much of the services, then you have a competitor at another store or another block then. So of course, you will go to a certain block, to another pharmacy, just to satisfy in terms of your needs. So it depends upon the need of an individual, no, need in terms of the satisfaction of the product or services. Now, moving on to the customer experience then. So there are certain experiences that are very tragic. When you go to a certain pharmacy and of course you are look like being discriminated or being neglected in terms of buying certain products, no, and the pharmacist doesn't explain to you well why is it that there's no certain medication, an antibiotic, why is it there's a need of prescriptions and all. So it depends really of the experience of a certain. So of course, if you have a bad experience, you will not anymore go to that kind of pharmacy or a kind of to buy that certain product or certain services. Now the value capture. Now, if you really have, you redefine how company gets paid or create innovative revenue streams, the processes, the organization, supply chain, the presence, networking, and of course, the brand. So this is what we call the 12 dimensions of business innovation. So it depends upon if there's really a gap in terms of the things wherein the customer does not really satisfy. Okay, so as a business person, as a business individual, you need to look at it. You need to have a research of what is really the gap wherein other companies offer it, but it is quite unique when when you offer that one to the public. Okay, so it depends upon this 12 dimension of business innovation. So you need to be innovative, because it's quite very competitive in the market. Okay, so remember that in the drug manufacturing or pharmaceutical products, then they really invest not on the R&D, not on the innovation of a certain product, no, or the drug development as what we call it, but then it matters on the marketing of a certain product. They invest a lot of it. Okay, they invest a lot of money in terms of the not the development, but how does this product market? What is something unique with the product and how to sell with the product? No? And of course, dealing it with the healthcare provider like doctors and pharmacists. Then, now drug makers spend around an average of 3 billion annually on the direct to consumer marketing, when the lion's share, with the lion's share, it means that it is our physician, our doctors then, of around 24 billion that goes to the selling and the marketing of a certain product to our clinicians and other healthcare professionals. So that really invests a lot in terms of marketing. It's not mainly on the research and development, but it is more into the marketing of a certain product then. Okay, so it mentioned there that 50% of doctors think patients who see direct-to-consumer advertising as more informed questions. Okay, so and 8% of a doctors feel strongly pressured to prescribe the advertised drug. Why is it? Because people or the patient or the consumer actually when they saw it in the market, or maybe their friends, their neighbors actually use it and it's quite effective for them, then of course what sometimes not this is quite very modern already now in this generation wherein people insisting of what kind of medication they want to be prescribed. Okay, like for example, what medication. So they really consumers really interfere, and that is because of the technology and information that they have seen, no? In the internet, in the Google and other medias. Okay, so really it really affects a lot. Now, this table number one actually matters on the spending, on the R&D, and the promotion as a percent of sales in the industry one. So you can see here that the total industry research and development, where the industry is defined as all companies, okay, with the patent drug on the Canadian market, okay, as you can see in the particular table, that range from as low as 792 million to a high of 918 million, and there is really a spending on sales representative and journal advertisement for the 50 most heavily promoted drug products. So you can see that even scientific journals are influenced then of this kind of advertisement to the to the public and even to our healthcare providers. So as you can see, and take note that it is more on advertising, promoting with the product, and marketing with the product rather than on the research and development. Okay, you can see on this slide that there are some companies like Allergan, Amgen, Stellas, AstraZeneca, and all of those which have the highest in terms of the total sales. They spend it in the research and development, but they spend more in terms of promoting their product. What do you mean by promoting their product? Really, what is then the differences? If that would be antihypertensive medication, what is the difference then of this branded product or innovator product with this innovator product, which is a B product? Now, that lies not only on the safety, efficacy, effectivity of the product, but it is how it is being promoted and distinguish it from other markets then, no, of a certain promotions, marketing of the product. Okay, so that is how, like, if that to be for Unilab product, of course, if you have John Lloyd or so we say a certain famous actor or actresses then, so of course you will say that they are really credible with a certain product, right? So really they use a lot of promotion and advertising for certain for this certain companies for their branded products. Now as you can see here that really there are in this figure that there are 7 stakeholders that are involved in deciding whether a new product is innovative or not. So as we all know, it is a job of the pharmaceutical marketers, the salespersons, to put pharmaceutical product in in the front of the people. No? And of course, these are usually consumers or drug prescribers, the doctors, healthcare professionals, the clinicians, and other healthcare professionals that already been marketed by certain pharmaceutical marketers or salesperson To do so effectively and efficiently in dealing with the sales, usually the sales representative or the pharmaceutical marketers then need to have a strong support and clearer understanding of the target audience more than ever before. No? So it's really no, a pain for the the pharmaceutical marketers and salesperson because they really need to have an effort not to go with the clinicians. No, marketers have to also convince the doctors by talking to them about the efficacy and effectivity of the drugs that they are marketing also. So they need to have background knowledge. That's why in the Philippines, when there is a regulation for those salesperson or pharmaceutical marketers to take an examination then no to our board here in the Philippines. Okay, so basically there is an examination for that. And on the other hand, pharmaceutical marketing has its own setup and challenges, and the marketers are tasked with the responsibility to measure and quantify these particular challenges that they have. After all, okay, they have to justify their spending and how they plan to handle these challenges. So it's not easy. You need to be educated also, no, as a marketer for this, no. So as you can see in this particular slide, that it is not the priority of the pharmaceutical industry to have this research and development, no? But then talking with researcher, investor, regulator for 12 years of pharmaceutical development, the drug development of it, going to a more prioritized in the marketing is more into talking with the clients on payers, providers, patient, regulators on how they market the product, how the consumers actually have these perceptions and change their behavior to actually buy a certain product. And of course, talking with the healthcare providers, the insurance system, no, that this product must be prioritized on all the products that they have. So basically, that's how PricewaterhouseCooper actually telling us about this particular slide. Now, also with the source of IMS intelligence in 2008 and the PricewaterhouseCooper analysis, that there are some products which actually have this truly innovative medicines that was launched in 2007. Okay, so like for example, Novartis, the Tectorna for hypertension, GlaxoSmithKline for breast cancer, and usually for HIV, breast cancer, from and of course other specialties drug, it is quite very unique, to have this kind of development for the people because they are going to solve major problems in the community or in the society. Then, like for example, a certain innovative then that will be launched by certain pharmaceutical product for COVID-19. So that's really part of an innovative medicines for 2020. Now, that's some of the branded medications that we have. No? And in this particular figure, it mentioned here that in 2020, there are pay for performance that will be in the norm of many countries. No? So by 2020, electronic medical records, e-prescribing, and remote monitoring will also give healthcare payers and providers in many countries the access to extensive outcomes data, no? As indicated in some of the literatures in the particular market. Okay, and they will be able to determine which medicines are particularly safe, efficacious, and cost-effective in different patient populations. Okay, you can see in the particular slide that in today, okay, um, way back maybe from 2019, it is actually pay plus prescription will be equivalent to payment. But nowadays, payment plus prescription, and they want to have an outcome. So people really are very particular nowadays with regards to the pay for performance. What is that pay for performance? It depends on how medication really works or does not work, how it is safe and effective to the public, and how it is actually specialized for certain populations. Before we can say that they really satisfy and they really pay for it, no, whether it is expensive or not, because of performance. Okay, that is according to Price Waterhouse Coopers. Now, this particular figure by 2020, the pharmaceutical or the payer, the insurance system, and the providers value chain will be much more closely intertwined or interconnected with this. Why is it that it is actually interconnected? Because, like for example, in the primary care, in the healthcare system that we have, of course, when there is a rise in terms of the financing, then it will also distort the healthcare system, right? How bills are being paid, how services, the healthcare system has been managed. Like example, the implementation of the government in terms of the universal healthcare, and what is then the impact then to the primary healthcare, to the barrios, no, to the barangay healthcare centers. And the emphasis of the government right now is more into the provision to cover more into the prevention, and then it's been analyzed into the healthcare system that how are we going to prevent certain risk factors, like for example risk factor in terms of smoking, and that is usually we say that the government really banned in terms of smoking and vaping also, no, so that really reduce in terms of the healthcare cost of the government. At the same time, the implementation of the prevention to the public, and of course more into the health promotion rather than going to the hospital, no, health education is there implemented that really reduce in terms of the healthcare costs of the government. Okay, so rather than spending on certain preventable diseases, like for example in terms of diarrhea, then no, wherein the water system is not that very good, that was in 1900s, but then nowadays because it is already implemented to have a good water system then, and the push of the World Health Organization and United Nations and other external factors to our government then, no? So and funding agencies really matters on the healthcare system per se. Okay, so it really have an impact then to all the cycles of the of this kind of chain, which are really interconnected. Okay, so that is all about in this particular slide. Okay, about the physician and consumers agree that over-the-counter medicines are the preferred first line of treatment. Okay, those three-quarters of all the primary care physicians will recommend an over-the-counter medicine before a prescription. Okay, so I think it's manifested then that some of the doctors, primary care physician, don't recommend their patient to be going into prescription medications, like for example antibiotics, no, if that to be deal on with certain over the counter for symptomatic illnesses, then let it be. But two-thirds of the consumer prefer taking an over-the-counter medicine when available versus a prescription. So that is based on the understanding trust in the over-the-counter medicine consumer and healthcare perspective by Nelson and IMS in March 2013. Okay, credits to them with that. So it's quite very viable in the market that this is really happening. Okay, So because at the same time, consumers are really aware nowadays, no, with regards to the certain medications that they are taking already. Okay, so that is all about that particular slide. So this basic slide actually telling us that there's really a push in not only with the R&D, but a big chunk of the budget, especially for Unilab. That's one of the example of the R&D process. Is not only with the research and development, but also in the marketing of the product and how they monitor in terms of the promotion, advertisement, and making sure that they really penetrate the market. Okay, that is very, very strategic as they go on as a top one for the pharmaceutical marketing in the country. That's a local manufacturing, a local company that is a number one in the Philippines. Okay, so there are a lot of strategies that they have. Okay, in terms of marketing and promotion and advertising. Okay, moving on. Okay, how do they market pharmaceutical products with regards to dealing with their consumers then? Okay, so that is number one would be in terms of direct marketing. So this method used by pharmaceutical marketing, including giving out free drug product samples, dealing it with physicians and clinicians and other healthcare providers such as pharmacists, and giving out drug coupons, promoting mailing, advertising via web and medical journals, as what mentioned a while ago, and direct to consumer marketing, providing clinicians with continuing medical educations. Like, for example, for pharmacists, they really sponsor some grants for certain healthcare organization like our organizations, no? In the Philippine Pharmacists Association and other like medical associations. No? So in that case, it really stick to the market retentions of consumers when they display their product, when they so it's very visible for pharmacies and healthcare provider to see the product and ask probable questions then with regards to side effect, with regards to their product presentations, and other datas then. Okay, so I hope it is very clear for all of us with regards to how they really market. So there are a lot of marketing strategies that they have. Okay, so this will be our critical thinking box that will be answered during our class. How would you convince a customer to buy your product? And what are your strategies then in retaining your customers? So it's very important to retain the loyalty of your customer. But what strategy are you going to use? And why do you need to consider customer behavior in the marketing your product then? So these are some of the critical thinking box that we have that we need to answer. Okay, so as a take-home message, that the demographic and social psychological characteristics of consumer really affect business industry. So I think it's manifested throughout how many years that certain pharmaceutical product really need to have research of their target market, okay, their customers or consumers, okay, to really penetrate into the business side of the market. And customer loyalty depends on pay for performance because our consumer nowadays are well educated with regards to the medications, okay, because of technology, because of informations that they have from the World Wide Web, okay, from the internet. And the factors influencing customer decisions such as social, personal, psychological factors, and more, and the current trends on pay for performance strategies for customer loyalty rely on safety, efficacy, effectivity, and others that may be a basis for customer satisfaction. I hope that it is quite very clear for all of us that really the demographic and social psychological characteristics are very important, to identify who will be our target market and who are really the behavior then no, of our customer or consumer. These are my references then. Okay, thank you very much to all of you. And of course, kindly subscribe in my YouTube channel. This is Dr. Erwin Martinez Falier, your professor in San Pedro College and a visiting professor in Bournemouth University, United Kingdom. Thank you very much.